29 weeks pregnant, so exciting. And I just got some hospital bills, and I wanted to share them with you.
Our health insurance system is so unbelievably broken. It's really expensive to have a kid in this country, but it shouldn't be. The average cost of having a kid in a hospital is $13,000 in the United States, and that jumps up to over $20,000 if you have a C-section. Ideally, your health insurance will cover most of that, but between deductibles, co-pays, co-insurance, the average out-of-pocket cost for having a kid is around $2,000. But that's only if you have health insurance, and 31 million people in this country don't.
I couldn't stop throwing up. Like, everything that I ate or drank just kept coming right back up, even water, so I had to go to the hospital. They ran a bunch of labs on me, found out that I had severe morning sickness. I was at the hospital for like 2 hours. They gave me some medicine, and then I was able to go home, no throwing up. That cost me $1,703.20.
And if you do have insurance, it can still be more than that. 1 in 6 families end up owing more than $5,000 in out-of-pocket costs. And if your newborn has health issues and requires neonatal intensive care, you can end up owing more than $10,000 out of pocket. The timing also matters. You can end up owing more if your kid is born in January compared to December. Libby Watson has done a great job chronicling this in her Substack Sick Note. She talked to people who ended up owing more because their kid was born in January because their deductible had just reset. So if their kid was just born a few weeks earlier in December, they would have owed substantially less because their deductible was already hit. And this really underscores the need and the moral necessity for a universal Medicare for all healthcare system. The rest of the developed world has this.
If this country wants to force women to have birth, then I feel that it's only fair that we force the country to pay for all of these births and all of these health complications.
For example, our neighbors to the north, most people in Canada don't end up owing anything out of pocket when they have a kid because their health insurance covers it. They pay for it with their taxes, and everyone gets to have a kid without being saddled with a giant medical bill. You can end up owing a little bit out of pocket if you want to pay to have a private ward, or if you want to have a midwife, but those are optional charges. But for the vast majority of Canadians who have kids, it's free. And it should be. But if you're one of the 31 million people in the United States who don't have insurance, if you have a kid, you immediately get hit with giant medical bills. And that's further complicated by the Supreme Court's looming overturn of Roe v. Wade. That will immediately make abortion illegal in dozens of states. So if someone in a red state without insurance has an unplanned pregnancy and they can't afford to travel out of state to have an abortion, not only are they going to be forced by their state to carry out that baby to term, they're also going to be hit with a giant medical bill. They're then destined to join the millions of people and the collective billions and billions in medical debt in this country. What a country. And I'm sure this will come as no surprise, but they get you coming and going. The average cost for end-of-life care is around $11,000. You really think they're just going to let you die without wringing out every last penny that they possibly can? The circle of life. But again, we have to fix this by implementing a universal Medicare for all system in this country, because nobody should be forced to deal with a mountain of medical bills just because they had a kid.